What are the most common questions I get asked when a parent brings their child in for scoliosis treatment? Hi, I'm Dave Butler, and today on the Scoliosis Experience podcast, I want to discuss the top 5 questions that I get asked on that first visit. It's interesting because this episode was sparked by an email that I received from one of my staff for a patient who's coming in to see. Well, I actually just have a phone consultation with this patient's mom, and she sent a list of questions that she would like me to answer either on that phone call or beforehand. And no joke, it was about 58 questions in that email, and I think that's a new record for me. Parents always have more questions. They have questions about all kinds of things, but there are pretty common ones that I get every time someone comes in who's diagnosed with scoliosis. So I wanted to. I'm not going to go through all 58 questions that she went through, although they were great questions. I think I love to see that patients or their parents have more questions so that I can know what they're thinking about, so I can know that they're actually involved and invested in treatment. So having questions is definitely not a bad thing, but we do have common questions that I want to discuss. On our website, we've had a Scoliosis 6 questions download for a while, and it's probably one of the most downloaded free reports that we have on our website. So if you're looking for some additional information, that's something that you can use. That's more specific to all scoliosis, not just adolescents with scoliosis. So not just what their parents are asking. So I want to go through specifically the top 5 that I get from parents about their children with scoliosis. Okay, if we get into the top question that I'm asked by parents when their kid's diagnosed with scoliosis and I see them for the first time, it is, will my child need surgery? This is a very common question and a common concern for a lot of parents, because a lot of times when you hear about scoliosis, you hear about some significant deformity in the spine and you hear about something that does require surgery. A lot of times people have family members who are diagnosed with scoliosis. There's a family history of the curve, and they're concerned that, the aunt or uncle or somebody, or grandma or grandpa, had scoliosis, and it ended up causing a lot of deformity, and it ended up with them in surgery. So that's a concern for a lot of people, that familial history. And then it's a spine problem. And so a lot of spine problems, a lot of people will assume that it needs surgery or it's going to result in surgery. So that's one of the first questions that I get asked. And the good news with that is that the majority of kids with scoliosis will not progress to needing surgery. And that's good news. Most curves don't get to the point of needing surgery. If we think about what percentage of the population is diagnosed with scoliosis, it's 3 to 4% of the population is diagnosed with adolescent idiopathic scoliosis, and the majority of those don't progress to needing surgery. There's a smaller percentage that progresses to needing surgery. So if we think about that, that's good news. The chance of your child's scoliosis progressing is relatively low overall, but there are some things that could indicate more possibility of progressing to surgery. So let's go over those a little bit. So number 1 is the size of the curve. The bigger the curve, the more chance it has of progressing to surgery. Surgery is usually done in adolescence at 45 degrees or between 45 degrees and 50 degrees. So if you have a larger curve, the chance of that progressing to needing surgery is higher, just because it's closer to that threshold for surgery. If your child has a lot of growth left, there's also a higher risk of it progressing to needing surgery. So if they haven't even started hitting their growth spurts and they have a scoliosis curve, they just have more time to grow, and that more time to grow can translate into more progression of the scoliosis curve. And then if they've had progression of the curve. So that's one predictor of will it progress, is if it has progressed. So curves that are stable, if you had a 15-degree curve and you've had that for a few years, a stable curve, the risk of progression is less because it seems to be stable. But if you've had progression at every x-ray, then the chance of it progressing is more. So I hopefully that makes sense. So we can have an idea of if a curve has more of a risk of progressing to surgery or not. We still don't know exactly which curves are going to progress to needing surgery left untreated. And so that's kind of hard when we're treating scoliosis, because we don't know which curves we really need to treat and those that we may not need to treat. So I usually err on the side of treating rather than not treating and wishing that we had. So that's kind of the answer with scoliosis and surgery. Will my child need surgery? Most likely no, but everyone's different and we need to look at it as an individual. So the earlier we find out about scoliosis and we start treating it, the less chance there is of it progressing to needing surgery, using scoliosis specific exercise and using bracing. And those have been shown to be effective. So question number 2, I get asked, will this get worse as my child grows? We kind of already talked about that when we talk about surgery. The more growth potential the child has, the more potential there is of the scoliosis curve getting worse. The reason that is the case is the growth plates in the vertebrae aren't closed, and so if we have a scoliosis curve that's progressing, there's unequal pressure on the growth plates in the spine, and so we get asymmetrical growth in the spinal column. And when we get that, then we can see progression of the curve. So that's, I guess, it's not a cop-out answer. We don't know quite if your child's curve will progress, but the more growth that they have, the more there is that chance of progression. So I don't like the wait and see approach for scoliosis. I don't like to wait and see if they grow and wait and see if their scoliosis is progressing. I like to monitor their curve and I like to treat when it's necessary. So monitoring isn't really treatment, it's just monitoring. So if we have a curve that has a risk of progression, early detection and early treatment is the way to go to keep that curve as small as possible. And that's what we see in the research. So if you have a child who is diagnosed and has a lot of growth potential, it's probably a good idea to get some early intervention with scoliosis specific exercise so that we can make sure that we keep that curve as small as possible as they grow. Number 3 question, can my child still play sports or be active? I get asked this question a lot, where it's usually specific to a sport. So I'll usually ask my patients what they like to do for fun. And if they say, oh, I like to do gymnastics, and then the parent, a lot of times they'll be like, is gymnastics good for their back? Should they stop gymnastics? Should they do something else? And the answer that I have is that no, I want them to be active, that they can continue to do their sports. There's no evidence that I have seen that shows that we should not do specific sports. And I remember as I was first getting trained in scoliosis treatment, I would see a lot of other practitioners, other providers talk about, oh, we don't want to do gymnastics and we don't want to do ballet because there's too much extension of the spine. The problem is ballet and gymnastics also increases core stability, strength, and body awareness. And I want those things for my scoliosis patients. When I was first trained, it was still told to scoliosis patients that they should swim because it's lower impact, and that would somehow preserve the spine and keep it from progressing. That's not actually the case. We're not seeing that in the literature, where one activity is better over another. Really, the bottom line is I want you to be active, whether that's swimming, whether that's gymnastics, whether that's horseback riding. I don't really have a preference as long as you are active. So the answer to that question, can my child still play their sports, is yes. I want them to be active. I want them to not sit on the couch. I want weight bearing into the spine to stimulate bone strength and bone growth that is strong. And I want their muscles to be active and actively supporting their body. There are some things to think about. If you're doing a sport that causes pain in the back, then we may want to make some adjustments or strengthen some things so that you have less pain when you're doing those activities. So that may be something. If you're doing activities that are one-sided, a lot of people think about tennis, and I guess you think about bowling. I don't know how many people actually bowl, especially adolescents, but those things where you're using one side of the body more than the other, I still think it's a good exercise to do. We just want to try and balance it out with other exercises. And definitely, if we are doing some of those exercises, especially those that you focus on posture like dance and ballet and gymnastics, doing scoliosis specific exercise like the Schroth method to gain more body awareness of how to pull out of the curve is definitely helpful, and I usually suggest that. So the answer to that question is yes. Be active, do your sports, do things that you enjoy and have fun with. I don't want to push you into swimming if you don't like to do swimming. I don't want you to stop gymnastics if that is the love of your life. And I would rather you be active and with all the benefits that come with that. So question number 4, what treatment options are there besides bracing or surgery? I think bracing and surgery are the ones that most people think about when they think about scoliosis treatment. And definitely surgery and bracing are treatment options for scoliosis. Surgery, if it gets to the point of needing surgery, I am not anti-surgery in any way, and it's effective in stopping progression of the curve. Bracing has been shown in the literature to be effective at stopping progression of the curve as well. Scoliosis-specific exercise has also been shown to stop progression of the curve and even sometimes show a reduction in the curve. And I think that's the one that most people don't think about or don't know about. They know about exercise and they think maybe I should just keep my core strong, or I should go to general physical therapy to work on strengthening. The research actually shows that general physical therapy and core strengthening doesn't have that much effect on the trajectory of the curve, meaning if it's going to progress or not. So thinking about that, if you're going to do exercise for the scoliosis to stop it from progressing, then you should be doing exercise specific to your scoliosis curve. And I think that's the key takeaway. It's not just core strengthening. It's not just physical therapy. It's scoliosis specific exercise. That means the Schroth method. That means the C's approach. That means the Lion method. There are a few other methods out there, but something that's structured specifically for the curve. That's where we see the most benefit as we try and specifically treat the curve and not just strengthen the core. Okay, question number 5. How will this affect my child's future? This is a question that I get a lot with how will having this curve affect their future? A lot of times it's about, will they have back pain in the future? Or when they get pregnant and have kids, are they going to have an issue with that? The answer, the real question that they're asking is, will my child be okay with this? Because scoliosis isn't something that's going to go away. They're going to have this the rest of their life. So what does the future look like for these kids? And I would say the majority of the time, the future looks just the same for kids with scoliosis as it does with kids that don't have a spinal curvature. Back pain is very common in our society with everyone, not just those with scoliosis. With kids with scoliosis that I see, it's only about 20% of those kids that have back pain. And the larger the curve definitely can create more imbalance. We see more back pain in kids with larger curves. So scoliosis doesn't have to be limiting in their future. And I think one key part of that is making sure that you are doing something for it while they're growing. If they're still growing or they're younger, the more you do for it to keep it smaller or to reduce the imbalances, the less it will affect them. So I think to get their scoliosis to not affect them in the future, early intervention is a big part of it. Detecting it early, doing your well child follow-ups with your pediatrician, making sure you are doing those things to find out if your kid has scoliosis, as well as monitoring for progression, but also doing proactive treatment like the Schroth method or the SEAS approach, something where you are addressing the scoliosis specific. Then in the future, it shouldn't affect them as much because we have controlled the curve as much as we could when they were younger. Bracing can definitely be a part of that. If we can keep the curve smaller with bracing, if that's indicated, if the curve's over 20 to 25 degrees, then that can also be helpful. One other thing that really factors into this is consistency. Consistency with doing their exercises, consistency with the brace, consistency with monitoring. All those things can give them a better outlook for the future. One thing that I noticed when I was I was in Croatia at the SOSORT meeting. The SOSORT is a research society that's over conservative scoliosis treatment internationally. And we were in Croatia and we were talking about this, and there was one of the researchers, Dr. Negrini. He was talking about if the curve is under 30 degrees when they're done growing, then we usually have less back pain. We usually have less imbalance. We usually have fewer problems later in life. And it was interesting to hear him say that because that's what I notice in my practice as well. I noticed that those who have smaller curves, it influences them less later in life, whether that's back pain, posture, people noticing their curve, things like that. So if we can keep the curve smaller, then we have a better quality of life. We have less back pain. We have less other issues. So if we want to keep them from having issues later in life, then we need to be proactive in keeping the curve small and keeping it as small as we can. So those are the 5 questions that I usually get asked when someone comes in for treatment. There are a ton of other questions that I also get asked on that first visit and in subsequent visits as well. This is something that we do all day long at my clinic. My therapist sees scoliosis all day long. I see scoliosis all day long. We get asked a lot of questions. Maybe not 58 questions like that mom sent me the email for, but those questions have answers. And I think we don't need to look at those answers as being something that's fearful or creating fear or anxiety. There's a way to treat scoliosis. There's a better way to treat scoliosis that involves giving the child as well as the parents more control over what happens with their scoliosis. And a lot of that relies on intervention that happens instead of waiting to see if it gets worse. There's nothing that frustrates me more than seeing a patient who has a 40-degree curve that has been monitored for the last 2 to 3 years, and they've been noticing progression, and no one has told them about scoliosis specific exercise. The research shows that it works. I've seen it in the clinic. The case studies that we have show that it works. My patients see a huge benefit to that, and when it's combined with bracing, it can really stop progression of the curve and even see a reduction. It's really irritating to me when those things happen where I can't change a 40-degree curve. I can't take away a 40-degree curve. We might be able to still reduce it some, but if I would have been able to work with that person when they had a 20-degree curve, we might have been able to stop it from getting even to a 30-degree curve. That outlook for that person, it's much different later in life than if they have a 40-degree curve, where they're really butting up against and approaching surgical range. So I think the biggest takeaway from this, a lot of these questions, I guess these questions come from people who are doing proactive treatment. They're coming into the clinic, they're being treated with the Schroth method, they're being treated with the SEAS approach or the other methods that we use. So maybe those aren't the ones that need to know about this as much, but the biggest takeaway for me is early intervention, being proactive with treatment, and being consistent with your treatment gives you the best result with all of these questions. So if we think about question number 1, will my child need surgery? If we're proactive with that and we're consistent, they shouldn't need to progress to surgery. I mean, sure, there are cases that will still progress to surgery, no matter what we do. But to give them the best chance possible, we need to do those things. Will this get worse as my child grows? The second question. It doesn't have to. We can control progression of that curve. Question number 3, can my child still play sports or be active? Sometimes back pain is a limiting factor with this. And the more we can train their bodies how to fight the scoliosis while they continue to be active, it's all the better. Question number 4, what treatment options are there besides bracing and surgery? We've already talked about that. There are other treatment options available. And question number 5, how will this affect my child's future? We can minimize the impact on the future, on their life from the scoliosis by addressing the scoliosis early. And by doing those things that help to stop progression, those things that have been researched and found to be effective. It's frustrating for me when I hear people talk about that the Schroth method doesn't really work or it's not really supported by research. If you do a review of the research right now, that is definitely not the case. Sure, we have some studies that are showing maybe minimal effect, but we also have studies that are showing a large effect and statistically significant effects from doing scoliosis specific exercise. So I'm excited to see the research that's going to be coming out in the next year. Next April, we'll be at the SOSORT meeting again, hearing the recent and upcoming research that's coming out. And I'm excited to see that because it really shows that we're progressing in this field. We're finding conservative ways to treat. And I'm also excited about surgical options that are coming up as well that aren't just fusion. So there are a lot of cool things coming in the future with a scoliosis treatment, and I'm excited to share those with you in future podcasts. So thanks for listening to this long-winded podcast where I'm just rambling about questions that I receive in the clinic, but I think it's helpful to listen to what other parents may be saying and questioning about their child's scoliosis so that you can do the best thing possible for your child. So thanks for listening. Tune in for the other episodes. We also have other episodes you can listen to from patients who have done the Schroth method and scoliosis specific exercise, as well as pre-surgical, post-surgical, all kinds of episodes. So check those out, and we'll see you on the next episode. Thanks.